Hello, everyone. We're about to start the webinar on breast augmentation. My name is Dr. Michael Streitmann. I'm one of the plastic surgeons with Westlake Dermatology and Cosmetic Surgery. Presentation will be short. Throughout the presentation, there's a chat box that you can enter questions in that we'll answer at the end. We'll keep it quick so you can get to your lunch. So if life gives you lemons, there is a simple operation to make your lemons go away. Next slide. So breast augmentation, just kind of an overview. I do all my breast augmentations under general anesthesia, so you're completely asleep and comfortable. The operation takes around an hour, sometimes a little less, every now and then a little more. The incision is usually made under the breast in the crease. It can be made around the areola. It can be made in the armpit. But with modern silicone gel breast implants, they're easier to put in under the breast, and that scar is usually not visible. Whereas if you're wearing a little dress or something, you can see that scar in your armpit. The sutures that are used are all dissolvable and under the skin. There's nothing to remove. You can use silicone or saline implants. The silicone implants are superior to the saline implants, in my view. I haven't actually done a saline implant since 1992. The implants can be either textured or smooth. I use all smooth implants. There is an association between a rare form of breast cancer and textured breast implants. That's why I do not use textured breast implants. The incidence of this rare cancer is only 1 in 30,000, but in my opinion, it's better to have your chance of getting cancer to be 0 in 30,000 if you're getting breast augmentation. The very next day, you can drive a car, you can return to work if you're not doing anything that's super physical. In 2 weeks, you should be back to full activities, running, jumping, lifting weights, getting hot and sweaty, whatever you want to do. There are different places to place the implant. Sometimes the implants are placed over the lining of the chest muscle, but under the breast tissue itself. That's referred to as a subglandular placement. There's a dual plane placement in which most of the implant is under the muscle, but some of the implant is not. Implants are never completely covered by muscle because the pectoralis muscle doesn't extend all the way to the outer lower part of the breast. And then there's the subfascial placement, which is over the muscle, but under the lining of the muscle. That's the location that has become like a new thing here recently in the last year or so, subfascial breast augmentation. Subfascial placement was actually described in 2003, and most of my implants have been in the subfascial plane ever since. It gives you all the advantages of subglandular placement without some of the disadvantages of dual plane placement. So most of mine are done in the subfascial plane. Where you put that implant isn't the same for everyone. Women have different anatomy. They have different lifestyles. Some women like to lift weights. All those things are factors of where the implant is placed. So the operation has to be tailored to the needs and the anatomy of the patient. Or as I like to say, one size does not fit all. Fun facts about breast augmentation. The implants that are used today are guaranteed for your lifetime. There's no other medical device that has a guarantee. If you get a knee replacement and it breaks, tough luck, you have to get another one and you have to pay for it. But if your implant breaks, you get another one for free. They are compatible with breastfeeding. They don't interfere with breastfeeding in any way. There is an internet myth that they have to be replaced every 10 years, like a set of tires. That is not true. As long as you're not having problems with your implants are fine to stay in. There's over 300 different sizes and shapes of implants, and they can range anywhere from 100 cc's in size to 1,445 cc's. The very large implants are used for breast reconstruction only. They're not used for breast augmentation. Lately, people have been talking about a ballerina breast augmentation in which women are choosing smaller sizes to have a smaller size breast. Usually these implants are anywhere from 300 to 350 cc's or less. A smaller breast implant is better for a woman with an active lifestyle. It is more subtle, it is more natural looking, but this is nothing new. The vast majority of breast augmentation patients are going from size A plus, B minus to size C, C plus. I would say that 90% of women that have a breast augmentation, if you saw them walking down the street, you'd have no idea they had ever had a breast augmentation. So I don't really understand the whole ballerina thing, because I think women have been choosing smaller size breast implants for many, many years. So here's some before and after pictures. This is a younger woman. She's in her mid-20s. She has a B minus cup in the before pictures and a C plus cup in the bottom pictures. This is a 325 cc implant. It is smooth, round, and has what's called a high profile. That gives the breast more projection and less fullness. And that's what most women who are small breasted are looking for. This is a subfascial placement. Second example, this is a woman with a B plus cup who's going to a small D actually. This is a subfascial placement as well. And this is a 350 cc high profile implant. These pictures are about 6 weeks after surgery. Here's another one. This woman has a little bit of breast asymmetry. As you can see, her right breast is a little larger than the left. Not so large that we had to put in different size implants, though. If we would have put in different size implants, the asymmetry still would have been there. So it's better just to go with the smaller implant. This is a subfascial implant once again, and she is 285 cc's. This is an example of a submuscular implant. She could have had the implant placed in the subfascial plane. She could have had it done in the subglandular plane. She could have had it in the dual plane under the muscle. She chose under the muscle. I personally feel that the under the muscle doesn't look quite as natural as the other placements, and the implants are usually a little further apart. The reason for that is that the muscle of your chest doesn't go all the way to the center of your chest. So the implant can only go towards the middle as far as your muscle goes. I mean, they still look good, but I just don't think they have quite the natural look that the subfascial or the subglandular placement has. And here's yet another one. This is in a woman who's a little older. She's already had her children. This is a 285 cc implant, once again in the subglandular plane. Young woman, once again, small B cup to a full C cup. This was a 325 cc high profile implant. Once again, this is in the subfascial plane. And since we're talking about breast, we might give a little mention to breast lifts and breast reductions as well. A breast lift requires a longer operation. It's about 2.5 hours of general anesthesia. You end up with an anchor-shaped incision that goes around the areola, straight down to the crease, and then lies in the crease of the breast. Sutures, once again, are dissolvable. A breast reduction can be performed at the same time. When you have a reduction, you automatically get a lift. But when you have a lift, you don't automatically get a reduction. If everything goes according to plan, you're back to full activities at about 3 weeks, and an implant can be added for extra fullness. So this patient is in her mid-40s. She actually was a massive weight loss patient. She'd lost 180 pounds, and she was interested in a breast lift. And we didn't remove any tissue at all. We kept everything we could. And she ended up with a small D-cup breast. And the after pictures that you see are about 6 weeks after surgery. Here's another lift here. Once again, mid 40s. And she didn't like the size of her areolas as well, which we reduced. This was about 4 to 6 weeks after surgery, as I recall. Her scars are still a little on the dark side. This is an example of a breast lift and a breast reduction. This particular patient had a double D breast on the right and a D cup breast on the left. So there was a significant amount of asymmetry. This picture here is about 3 months after surgery. Difficult to see the scars that go around the areola. The only one you really see is the one going from the areola down to the crease, and the scar in the crease is pretty much invisible from the front, but from the side view, you can see it coming around the side and stopping at about the front of the armpit. So we are having a special for May and June of this year. It's $1,000 off a breast augmentation or a breast lift or a breast reduction, if that's what you would like to have. You can make an appointment online through the website at westlakedermatology.com, or you can call the office in Houston for an appointment with me in Houston. You can call the office in San Antonio for an appointment there. I'm in San Antonio on Fridays. Or if you're in the Austin area, you can call any of the Austin offices where we have a plastic surgeon. And that's the end. We'll take some questions.
Dr. Streitmann, I do have some questions for you. I did also want to remind you that the special is exclusive to you only.
It's only to me only. So forget about the doctors in Austin. I kind of overstepped that. But you're welcome to come see me in Houston or in San Antonio for the $1,000 off.
Perfect. Okay, so here's some questions. How about this one? Patient asked, after augmentation, when can they shower?
You can shower the very next day. These sutures are all under the skin and dissolvable, and the incision itself is usually about 1 inch to 1.5 inches long and is covered with a protective tape after surgery.
Okay, now you briefly touched on this, but someone else is asking about breastfeeding and how that works with implants.
Implants do not prevent you from breastfeeding in any way. They're away from the breast tissue, so there are no restrictions on breastfeeding with breast implants.
Okay, so what about mammograms? Can I get those like normal?
You can get a mammogram just like if you didn't have a breast implant. They do have to squeeze the breast a little tighter in the machine to push all of the breast tissue in front of the implant so they get a good picture of the breast tissue. So a mammogram might be a little more uncomfortable for a woman with implants than for a woman without.
Do you recommend waiting until after children to get a reduction?
That's kind of, you should get a reduction, in my opinion, when you feel that it's going to benefit you. We do breast reductions on 15 to 17-year-old women that are just miserable, with huge breasts that are heavy. You can get it done at any time during life. When the symptoms are such that it's bothering you, it's hurting your lifestyle, it's hurting your neck, it's hurting your back, you're getting rashes under the breasts, all of those. Once you're ready, you're ready.
Okay. Are you comfortable giving an average or a starting cost of an augmentation with implants?
The implants themselves are $1,800. Usually the anesthesia and facility fees are around $1,500. And usually the operative fees, everything totaled is usually around $7,500 to $8,000.
Awesome. Tell me more about the myth with textured implants, or is it the truth?
Textured implants Some of them have been removed from the market. The ones that were highly textured, those are the ones that were most associated with that rest form of breast cancer called anaplastic large cell lymphoma of the breast. Those were absolutely removed from the market. The more lightly textured implants were not removed from the market. In my 26 years of being a plastic surgeon, I have never used a textured implant. They can be more expensive. They can cause more problems. I just don't see any advantage in using them. And they're more expensive than a smooth implant.
That's fair. I really like this question. How robust are the implants? For example, for women that are practicing martial arts, boxing, that sort of thing.
I've only seen one implant in my career that ruptured in response to an accident. And that was an implant that a woman was kicked in the chest by a horse, by the back legs, and the implant ruptured. That's the only time, and I have personally seen one rupture due to trauma. I have had one other implant in a breast reconstruction patient that when I was doing a secondary procedure, I found that it had ruptured on its own. The rupture rate is about 0.75% at 7 years. So if you did 1,000 MRI scans at 7 years after placement, you're going to find about 7 ruptured implants. We actually have on my Instagram, we have a video of actually Ashley, who's asking the questions, stepping on an implant with a spiked heel, and it doesn't rupture. So they are pretty robust and pretty tough.
Okay, and then one more for now. I have larger breasts, but all of my breast tissue is on the bottom. What can implants do for me?
Not much. What you really need is to have the good stuff at the bottom put back up at the top. You would be more of a candidate for a breast lift than a breast augmentation.
Okay.
Is that all of our questions?
Oh, one more.
One more.
And I'm confident asking you this because I know you as a surgeon. What is your percent rate of risk or complications in your patients?
Very low. The worst things that could happen to you would be an infection. If an infection happens, then both implants need to be removed, and you can try again anywhere from 6 months to a year later. I've never had to remove an infected implant in 26 years. Second worst thing that could happen to you would be a blood clot around the implant. I had one patient that was in a car wreck 48 hours after surgery and ended up having a blood collection around her implant. Or it can just happen after surgery. I've had that happen 3 times in 26 years. And then lastly would be capsular contracture, which is a tightening of the scar tissue around the breast implant. We think that's related to chronic low-grade infection. I've had that happen 5 times in 26 years. And in all 5 of those patients, it was only one side. So it wasn't an interaction between the patient and the implant, or both implants would have been hard. So bad things can always happen with any surgery, but the complication rate from breast augmentation is pretty low.
Great. Thank you, Dr. Streitmann.
Thank you, everybody, for tuning in. And remember, if you'd like to make an appointment, that can be done through the website at westlakedermatology.com.